let you in.
Winter has arrived at West Suffolk Hospital, and with it come patients like Gordon. He's 84 and he woke feeling washed out and breathless. He rang his GP and she told him to call an ambulance. Gordon is a typical patient. This hospital serves the second oldest population in the country, and in winter they're vulnerable.
Hello, sir. Hello, sir. I'm Nick Jenkins. I'm one of the consultants here in the emergency department.
Any exertion,
Yeah.
can do it.
1 in 5 people in Suffolk is over 65, and in a few years it will be 1 in 4, putting it on the front line of a demographic shift that threatens to overwhelm the NHS.
So he's exactly our bread and butter. We're a district general hospital looking after a catchment population that is half full of people like him.
And how would you put confidence ahead of winter?
Nervous. I can't believe there's anybody working in the NHS who isn't nervous about winter. We are prepared. We are as well prepared as we've ever been.
West Suffolk is among England's better performing hospitals. It's rated outstanding and gets closer than most to hitting its targets. But even here, winter is a struggle, and they can never be quite sure what will come through the door.
I'm going to ask you what brings you here today, Mrs. Nunn, but
you can see.
I can see it. How did it get there?
I was dressing a fish out and pulled it out of the fish and it flung back and hit me on the finger.
So you were cleaning a fish?
Yeah.
For work or for tea?
No, for the cats.
OK.
I was doing the carpet tiles and the knife just slipped and went straight through the top and through the back.
Oh, yeah. How much does it hurt?
It's not too bad, to be fair. I was more worried about them if it went through the nerves, if they had to chop it off, but it's movable, so I'm hoping that I'll be able to keep it.
Chief Executive Steve Dunn and his team have been planning for this winter since before the last one ended. The main change for this year, a new acute assessment unit designed to ease pressure on the emergency department.
We have predicted quite a significant increase in attendances and admissions. We've tried to anticipate that by bringing in additional capacity, though if we can't staff that additional capacity safely, we will not open that, and that will place a challenge on us, and we will have to cope.
By the end of a day that brought more accidents than emergencies, the planning appears to have paid off. The next morning brings a change of pace. We joined the early shift with East of England Ambulance Service, which covers 6 counties and almost 6 million people, many of whom end up at the West Suffolk. Alan is a classic winter case. He's in his 70s and short of breath. The crew give him oxygen and bring him in. It's our second morning at West Suffolk Hospital. It's just past 9:30 and already 1, 2, 3, 4, 5 ambulances. I can hear another one on the way. It gives you an idea of the fact no matter how hard this hospital works and the ambulance crews, the pressure and the demand just keeps on coming. Alan arrives into an emergency department that is busy and close to capacity, and where crucially almost 60% of patients are having to be admitted.
So we've had 72 patients so far today, fairly busy for this time of day, and we've got 31 in the department at the moment. So we're actually full as a department in terms of our cubicle space at the moment. So what it's all about at the moment is trying to clear something.
That brings pressure to find beds on wards and to only admit those who have to stay overnight.
How are you feeling, Alan?
Not better than I did.
Alan is going to be among them, but the NHS is a source of huge reassurance.
Vital. It's a system that we've got that nobody else has got, so we should look after it.
At this time of year, no day is like the last in the NHS. But from here on in, every one will be a challenge. Paul Kelso, Sky News at West Suffolk Hospital.